Woman, an in-depth exploration of the world of women today with Samantha Dean.
Good evening. Tonight we're going to be talking about medicine cupboard addicts, or pill poppers as they're often referred to. 2 billion prescriptions are written every year for 35 million Americans who take pills to pep themselves up, slow themselves down, go to sleep, lose weight, relieve stress, and a variety of other reasons. The family medicine chest is also becoming the spawning ground for young children as far as drug abuse is concerned. With us this evening to discuss some of these problems are Dr. Christopher Demander, the Director of the Emergency Drug Abuse Service at the E.J. Meyer Memorial Hospital at Buffalo, New York, Mr. Richard Mehta, Director of the West Side Drug Service Counseling Center, a division of the Legal Aid Bureau Incorporated at Buffalo, New York, and Miss Jana Henderson, who was a dependent at one time in her life on drugs and has been drug-free now for the past 6 years. She is now counselor of the West Side Drug Center at Buffalo, New York. Dr. Demander, of these 35 million Americans who take pills, what percentage go on subsequently to become addicts?
It's really difficult to speak about what percentage of those 35 million because there are many other people who take pills and are addicted besides just the ones who get their drugs legally. The Food and Drug Administration had estimated in 1970 that some 8 billion doses of amphetamines alone were available or produced in this country. They estimated some 50% were in fact diverted to illegal channels. But anyway, that production level would supply approximately 30 to 50 capsules of amphetamines for every man, woman, and child living in the country.
Now, you mentioned amphetamines. Richard, could you explain the difference between amphetamines, barbiturates, and narcotics?
Surely. Amphetamines are your uppers, your stimulant drugs. A generic example would be methaqualude. Often women will take amphetamines in the form of diet pills or pep pills. Downers or depressants or barbiturates are another classification of drugs. They are usually central nervous system depressants. They slow you down. They're sometimes used in psychiatric cases to tranquilize a person or to slow their respiratories or their actions down. And the last classification you asked about was narcotics. That's generally that's a legal term actually, and it includes a lot of drugs, both illicit and legal. Most people, however, think of narcotics as illegal drugs, but that's a misconception.
Would codeine, for instance, cocaine, would these things be included under narcotics?
Yes, legally, according to New York and federal law.
Mm-hmm.
Yes,
I see. Just how easy is it to become addicted to a pill, such as a diet pill, for instance?
Well, each pill has its own potential, if you will, for addiction. But addiction should be understood as as I think best defined by Dr. Jaffe, Director of the Special Action Office for Drug Abuse Programs in Washington. And his concept of addiction is the compulsive use of a drug with a strong tendency to relapse if for any reason the drug is interrupted. In other words, the addiction state is something that any person can develop if they have certain kinds of needs which are met by the drug. Amphetamines particularly have this very strong abuse potential and addiction potential because they provide so many nice feelings for people who are looking for feelings of relief, some degree of euphoria, feeling of well-being, a number of things that they believe will help them solve their problems or perhaps at least be allowed to help them cope with their problems better.
Mm-hmm. Well, what would be the difference, for instance, between an addiction to a barbiturate such as phenobarbital and an addiction to heroin in intensity and withdrawal problems and so on?
Well, one can be addicted to either of those drugs without being physically dependent. The withdrawal syndrome that is associated with certain groups of drugs only is present if those drugs produce changes within the body metabolism after continued use at a certain dose and a certain frequency. Certain drugs, for instance, such as marijuana or LSD, have no dependency potential. That is to say, they do not produce physical changes in the body. They obviously are drugs to which people can become addicted. But in relation to the distinction of the withdrawal syndrome from barbiturates as distinct from heroin, I think it's very clear that the withdrawal syndrome from barbiturates is a life-threatening problem, inasmuch as if a person is stopped cold turkey, so to speak, from barbiturate use and has been using a lot of these drugs, they can have a seizure as a part of their withdrawal syndrome, and that seizure can cause death.
How about a baby born of a woman who's been taking barbiturates during her pregnancy? What's the situation here?
The baby can be born either chronically or acutely addicted or dependent, if you will, very much as an infant could be born to a mother using heroin on a chronic or acute basis. The difficulty with a newborn infant is to understand what the problem is. Most mothers do not indicate their drug abuse history at the time of delivery, so that if the baby is chronically exposed to the drug while in uterus, the infant will not begin to show the withdrawal syndrome until 2 or 3 days after delivery. And this is poorly perceived and understood perhaps by the pediatrician who's caring for this infant who's suddenly becoming ill with no apparent reason. The baby born to a mother who has acutely, just recently used either heroin or the barbiturates, that infant would be born with a respiratory depression syndrome, and there would be immediate kinds of things that would be done for the infant at that point to resuscitate and maintain him in a living state. The difficulty with the infant born to a chronically addicted person with either of those classes of drugs is that the infant may have a seizure and the infant may die.
Jana, I'd like to ask you something. I think you're in a position to answer this rather well. You can either answer it from a personal point of view or a general point of view. Do you feel that women are more prone to be addicted to pills of this nature than men?
It's kind of hard to say. I don't have a lot of statistics to back me up or anything. It's just sort of feelings I have from excuse me, from my own personal sort of experiences from people I've met through my job, that I see a lot of women who do have dependency problems, and I think it's possible that there are more women than men involved with medicine cabinet sort of drug
Why
taking.
do you think this is? What contributes to this?
Possibly the fact that they are the ones that are at home more. They're there with just ordinary housekeeping duties and children to take care of, and it's sometimes very difficult for a woman to do these sorts of things if she feels she's not achieving her potential and that sort of thing. It makes it easier to deal with three preschool kids if you can take a tranquilizer and they don't get to you. Or if you're exceptionally tired, it makes it easy to deal with them if you take a diet pill. Or take 2 diet pills and you can get your housework done twice as fast,
Right.
this sort of thing. This is a lot of the things that I feel would tend to make women more susceptible. And also the fact that we were talking about it earlier, and the fact that there are more women seeing doctors than men. More women go to doctors for weight loss problems, for weight problems, to get diet pills, to lose weight. Fine, their reasons for going are good ones. They want to look attractive. But they find out that after they've lost their weight, it's easy to take one when you need it to get the vacuuming done on time.
All right. Well, this is one specific problem that people
Yeah.
go to doctors with. But do you think that there is a sort of proclivity amongst doctors to obscure perhaps the underlying problems by writing prescriptions a little bit too freely? I mean, how easy was it for you to get a prescription?
Oh, extremely easy. There's a lot of doctors across the country that write prescriptions for almost no reason at all.
And how
I
is
know of people that come into our center who have had drug problems or who do have drug problems, who can go to a doctor and get a prescription for whatever they say whatever they tell the doctor they want.
What do you think the medical justification for this is?
There's
Dr.
none.
Fernanda?
No, there's,
Not at
there's
all.
none at all. It's,
Well,
it's
I think
really
it's a-
tragic.
I think it's an easy answer to a complex problem, and unfortunately, doctors don't have the time in many cases to treat problems like I think they would like to. And of course, pills and medication is a quick way to cover up symptoms. It's a band-aid approach to underlying problems, and I think doctors, because of their caseloads, because of the time pressure, tend to overprescribe medication in many cases. I think a psychiatrist, because they can't spend enough time with patients in a therapeutic setting, also tend to overprescribe, let's say, tranquilizing drugs. I think Thomas Zah's study, Dr. Zah's study of state institutions is a relevant example here. He pointed out that, in his opinion, depressants and antidepressants are used more than they should in state hospitals and institutions, more to appease the staff of the hospitals than because of the need of the patients. In other words, because they don't have the manpower to help people like they should be through counseling and individual attention, they control them easier by drugging them. And this is, of course, a trend that's changing. People and women and men in state institutions are being taken out into the community more now. You're finding more of a community mental health approach to problems, which is obviously the more appropriate means of helping and solving these problems, and less of the overprescribing syndrome that I was indicating, but there's still evidence of this.
You're talking, though, about a particular setting for prescriptions, which is within an institution. And I think you were very nice about what the medical the reasons that the medical profession might have for prescription writing, but I think there's no ability to excuse the medical profession, which has a very real hand in contributing to this problem in terms of compounding the issue. Of course, doctors are overworked.
Right.
Of course, they don't have time to spend all the time they do want it with patients, but you don't compound that problem
Right.
by giving a pill or a tranquilizer, especially with the amphetamines, which have been known now for the last 10 years to be totally incorrectly prescribed for the two major uses that people go to doctors for getting them. One, to lose weight, and the other because of their depression.
I think there's two other considerations that should be discussed here. Those are pharmaceutical houses and mass media. I think there's, for example, a lot of overprescribing of those two types of drugs, amphetamines and downers or barbiturates, or whatever type of depressants we're talking about. There's enough overprescribing so that drugs like these get out on the black market easily because there's more than are really needed for legal medical uses. The second consideration, which I was alluding to, was the mass media. I think let's tonight, all of us, turn on our TVs after this show, not on an educational TV station as this is, which fortunately doesn't have a lot of advertising or any, but let's turn to another station, a commercial station. Let's count the drug advertisements in a 2-hour block of time. And of course, aspirins are drugs, NyQuil, and I shouldn't mention products, but all these things are drugs. Let's just count how many. Let's consider the saturation. Let's consider the medical society that we're in, the drug society rather, the medicated society, in view of this problem. I think you can't avoid those issues.
And if you put it in terms of the woman sitting at home in the afternoon, watching television, you know, watching the afternoon shows and the games and things, every 5 minutes she's got a commercial to sit and watch that's filling her head with don't feel discomfort. You know, this has gotten to be almost the national cry. God forbid any of us should feel any sort of discomfort
Well,
at
now,
all.
these are non-prescription drugs. Do you
These
think
are-
these are setting the stage, establishing a psychological climate that is conducive then to go on to other drugs?
They're non-prescription, they're over-the-counter drugs, but it makes drug taking okay.
Sure.
It
So
makes
what-
it okay.
What they're doing then is building the two essential sides of a commercial equation, if you will. The media are promoting a large market, a large demand, if you will.
Right.
The medical profession has been entirely too permissive in making the supply all too ready. So that those two essential factors are operating and have been operating always. This country has always been dedicated to quick results
Right.
quick solutions, panaceas for all kinds of ills, which
Exactly.
are much too complex to handle with either one capsule or one visit to a doctor.
Don't you think also that the quality of medical practice may be affected, because it's far easier to scribble on a pad than it is to go into a long session unraveling the psychosomatic causes for this type of behavior? And also the doctor perhaps is communicating that this is a perfectly valid and very acceptable way of dealing with an emotional problem. What combinations of drugs do you feel taken perhaps by the average person unwittingly, perhaps drugs and alcohol or drugs and caffeine, might ultimately prove fatal?
Drugs and alcohol, I think, would be the biggest.
Any types of drugs and alcohol.
Well, let's
Well, any downer.
right.
Yeah,
Any
Point is,
downer
the most
combined with
common
alcohol.
use of alcohol as the major drug of abuse in this country to begin with, we'll say, but combined with a growing use of barbiturates or a growing use of the opiate drugs, whether they're legally available, such as the Dilaudid and Demerol pills, or illegally bought on the street, such as heroin. Those combinations of drugs which have as an initial effect a depressant action, they are, for the most part, synergistic. They act together in producing a total effect on the body which can lead to death rather easily.
How about the stimulants such as caffeine, which is a mild, relatively innocuous stimulant? If this is combined with any type of drug, can this prove fatal?
I don't know of any direct response or use that report that caffeine per se would produce a fatality. The most frequent combination, as I said, is alcohol with the other depressant drugs.
It's a lot of smoking in a room sometimes drives me nuts. I wouldn't consider that a fatality, but I'm an anti-smoker, so that's considered a stimulant, of course.
To get
Nicotine.
back to this over-prescribing and perhaps too freely prescribing for drugs, what stand is the American Medical Association taking on this, perhaps to crack down on the advertising of the pharmaceutical companies, or perhaps the FCC? Would you like to see a ban on television, as you were talking about, against all this sort of advertising, as
Definitely.
has been the case
There
with
are
cigarettes?
there are movements in Congress to limit drug advertisements. There was an article in our local Buffalo paper recently which suggested a building trend in Washington to try to at least limit drug advertising time on television.
Well, there have been recent articles also. There was one that Samantha and I were talking about earlier, entitled "The Corporate Pushers."
Right.
One of the U.S. senators was making an effort in Congress to deal with the amount of the contribution in millions of dollars that were being spent yearly on advertisement of drugs, and trying to have an appraisal of what that meant in terms of creating the climate, if you will, creating the market where people would feel that, well, I'm hearing about all these things on TV or the radio or whatever, maybe I ought to try one to see if it really won't help me because I can't tolerate my life at home. And that's just described in billions of dollars or millions of dollars a year spent on the media, and there are no easy ways to control that. One of the efforts that was made about the amphetamines just after the Second World War, when the major form of amphetamines at that time was with the inhalers, and inhalers were over-the-counter available. They were containing both, either benzodrine or dexedrine. The abuse became so glaring and so apparent that finally the Food and Drug Administration was able to declare a ban on the over-the-counter sale of those inhalers. But they did say that they could be had by prescription. That did not deter the producing industry at all. The ban was on benzodrine and dexedrine. There are many other kinds of amphetamine drugs which have similar kinds of actions. And so the switch in production went to these other amphetamines. And so that the Food and Drug Administration got some legislation which was passed, but it was minimal and had no effect on the total of use or availability, really, of amphetamines in the country. In fact, they've expanded even more now behind this other use for overweight, which is really largely a white middle-class suburban housewife's problem, and depression, which fits most chronically into that same group of people.
Well, what do you feel the AMA, the American Medical Association, can take any stand here?
Well, I think that a profession or a physician, or for that matter a person who does not learn how to control and police his own activities ultimately is going to invite policing from other sources. And this is, I think, what AMA is running the risk of.
And of course there is a certain conflict of interests,
Of course.
because it is the recipient of large sums of money in
Yeah.
form of grants, isn't it, from
Mm.
various
Yeah.
drug companies.
And it's very hard to try and deal with a presumably generously oriented population, quote-unquote physicians, and tell them that they cannot do certain things. This smacks of all kinds of autocratic control, which a professional person generally and specifically is very resentful of. But the medical profession has not responded to this challenge. There is one, Suffolk County, a while back, made a concerted effort between a combination of the pharmacists and the physicians in the community, who agreed that they would pharmacists agreed they would no longer fill amphetamine prescriptions. The physicians said they would not write them. And that was the only way they kept legally available amphetamines out of the county, and it worked. But that kind of coordination, and you will, cooperation, is a very rare thing.
There's something similar going on in Canada, isn't there now, where if a patient asks and a doctor prescribes an amphetamine for under 30 days, it has to be registered with the health department. If it's over 30 days, he has to have a consultant physician who will document this, confirm his diagnosis. Do you think this could work here?
It would be, well, I suppose it could. It would mean a lot more paperwork, a lot more time of people involved in, I think, what only could be described as a halfway measure. The point is that amphetamines are not medically indicated in the two primary conditions where some of those 35 million prescriptions were being used, obesity and depression.
Yes.
They're just not to be used there.
Jana, back to the media for a moment. Do you feel that harm is being done to children these days by seeing on daytime television children popping pills, vitamin pills, and subsequently feeling very much better, and just the generally tremendously palatable medicine that's offered to children nowadays?
Oh, yeah. Vitamin pills, stomach pills, any kind of pills, not only if it's directed at children, but at adults too. But specifically, as you mentioned, the children's vitamins and things. Everything tastes good. It's candy. Medicine shouldn't taste good. Medicine is medicine. And
Right.
you know, if it tasted bad, they would be less inclined to eat a battle.
Yeah.
About vitamins, again in relation to amphetamines, when the FDA did that survey, there were some 15 vitamin and hormone preparations available on the market, all of which contained amphetamines. In other words, not only are these various drugs marketed in isolation, they're marketed in combination with other drugs, so that a person who may be taking vitamin pills and think, you know, gee, I'm really feeling good, those vitamins are doing me the job. Well, they're getting a little dose of amphetamine along with it. And no wonder they're getting, you know, boosted up.
Joseph Stetler, the president of the Pharmaceutical Manufacturers Association, said that the reason that the public are underusing drugs is because they've been scared off by publicity about drug risks and drug abuse. What do you feel about this, Richard?
I think it's humorous. I don't believe it, and I think
One wants to know what his standard of correct usage is, because
Right.
the current one is underused.
I think his bias is fairly well shown,
It's pretty
evident.
Yeah, I've never seen, I've been in the field of drug abuse for 5 years, and I've never seen to such an extent the number of young people specifically taking amphetamines and barbiturates. It's phenomenal. The numbers are phenomenal.
I think it's interesting to note that this is the trend too, at least in our community, where our center's located, where Jana and I work. The trend is away from hallucinogens, which used to be the fun drugs for kids, and now they're uppers and downers, especially downers. I don't know if this is a national trend. Chris might be more aware of that, but it definitely is the in thing now, at least in our area, in high schools and colleges, to pop a downer, to be relaxed and to be cool. And
Would you feel that what used to be sort of accepted as the trials and tribulations of everyday life is now being sort of redefined as a medical problem?
I think not necessarily just a medical problem, a social, medical, down the line, legal. You know, there's a whole string of things it can be defined as. Interesting to note, though, a lot of the kids who are getting these pills are getting them from their mothers and fathers' medicine cabinets.
Yes.
You know, they aren't going to doctors themselves and getting prescriptions. Their parents already have the prescriptions.
Mhm.
And that's where the kids
This
are
was a
getting them.
point that was made in a really excellent study that Richard Blum made. It's in a book form now called Horatio Alger's Children. And one of his points is that he has made an intensive analysis of a number of families in many different socioeconomic groups across the country. It's very clear that children who are in houses where drugs are used routinely tend to become drug abusers, whether those drugs, as far as the parents are concerned, are used in a regular way or not. But a family where barbiturates are routinely used for sleep, or where one member is on tranquilizers, children in that kind of family setting have a much higher risk of becoming drug abusers.
I think it's significant enough to repeat the fact that you mentioned, Chris, that alcohol is still our #1 drug problem in this country. I think it will be for many years. And it's, of course, mainly abused by the adult community. It's an institutionalized Americanism. It's legal. It's as American as school, I guess. Booze.
And amphetamines, did you say is the number 2?
Mm-hmm.
We were talking earlier on.
No, amphetamines are the number 2 in this country, at least. Well, numbers are perhaps not too helpful in terms of trying to evaluate either total numbers of people using drugs or even ranking drugs of abuse. I'm not inclined to get into a numbers discussion, primarily because I'm concerned about what the numbers mean, not what they really are.
Mm-hmm.
The numbers mean that there are a lot of people choosing solutions to some problems that they have, which are totally inappropriate solutions.
Aldous Huxley fantasized in Brave New World about a sort of situation where we'd become a nation of robots in whom any types of feelings, particularly strong emotional feelings, would just have no place, and we'd be trained to pop pills to restore our peace of mind. Do you feel that this situation that he fantasized about is about to actually happen?
Well, if you look at what is becoming has been available in the realm of mental health, there's no question that we're there in terms of people who are not able to be admitted to routine social kinds of activities such as work, home life, and so on, who can be maintained on very strong and potent tranquilizers and survive. In other words, behavior modification is with us.
Thank you very much, Dr. Demanta, Jana, Richard. Thank you for being with us. We'll see you again next week. Good night.